from the measures taken to contain the spread of COVID-19. But the numbers of infection are rising rapidly. Today, Kenya has recorded a 3-digit figure from just 1 day's testing.
An escalation in targeted mass testing numbers is slowly unraveling the true COVID-19 situation in Kenya. With 3,077 samples tested, some 123 people have now tested positive over the last 24 hours. But there is more, starting with right here in Nairobi.
Nairobi is once again leading with a total infection of 85 people, followed by Mombasa with 24, while Kiambu has 4, followed by other various counties.
It is also becoming evident that urban slum settlements might become the next big breeding grounds for COVID-19. For instance, Nairobi's populous Kawangware, Eastleigh and Kibra neighborhoods have been on the government radar, but now Mathare is also in the mix.
Again, for the first time, we have recorded a very high number of 33 people in Mathare. Kibera remains high as well at 14, Embakasi West at 12, Embakasi Central at 4.
And after a lull of over a week with no new casualties, COVID-19 has returned with a vengeance, claiming 3 more lives. All 3 had underlying medical conditions, including one who had cancer. And now the total number of those dead has reached 55.
We have grown now into 7 in critical condition, 4 are on ventilatory support, while 3 are on supplemental oxygen.
While the collective national effort is directed at fighting this virus, allegations still dog the Ministry of Health. Some 30 officials were recently transferred, some cases active at the Directorate of Criminal Investigations, but some officials are said to be still engaged in irregular transactions. The Health CS says Afya House, like any large entity, might have its own mafia gangs.
This building here, called Afya House, has some very good people. It has got some very committed people. It has got people who work day and night, who work so hard in such difficult circumstances. But this building here has got its fair share of criminals.
While recording large numbers of COVID-19 positive cases from an expanded sample tested might not necessarily indicate that the situation is getting out of hand, an emerging area of concern is how the government will be able to stem the spread of the pandemic, especially in large urban slum settlements. Mark